Hello, this is Dr. G, your favorite dentist. I would like to talk to you about fear in dentistry. And I want to start with a very nice story, something real that happened, and it made me realize the factors in fear in dentistry. Years back, I had this grandpa who had adopted this little kid, 6-year-old kid, named Selena. And Gene brought Selena into my dental office. And he said that she has to be wrapped into a papoose board. We don't know what to do. She fears dentists like there's no tomorrow. And she brought her right into my dental office. And I said, you know, Gene, you are my neighbor. Why don't you bring Selena to my house sometimes? I don't want to see her here. Gene called me one day and said he's had a good time, and he brought little Selena to my house. I was wearing my pajamas, and little Selena came to the door, and as I opened the door, Gene was standing right there. And I looked down, little Selena was right there smiling, and I invited them into my house. When they came in, first thing she did, she was looking around and she said, Dad, this guy actually lives in a house. It just dawned on me that a lot of people, they think dentists are coming from some outer planet. They're some strange beings. They're not even human. They say hear the truth from children, and that's very true. I brought Selena into my house. Then she came in and she looked at the table and she said, oh my God, Dad, this guy eats watermelon just like us. I invited little Selena. I gave her some watermelon. And then next thing is I told her, would you like to have a stuffed animal? Every year after the holidays, I buy a whole bunch of stuffed animals, like after Christmas, after Valentine. I go and buy them when they are 50% off, 75% off. And we take them in our mission trips. We take them to orphanages and children. So I always have a house full of stuffed animal. So I took one of the stuffed animals and I gave it to her, and she was so happy. And next thing is I asked her, can I see your smile? She showed me her smile. And I said, can you open your mouth for me? She opened her mouth. And I said, can I count your teeth? I started counting her teeth. And while I was counting, I was looking at the condition of the teeth. I was looking to see what's going on in her mouth. And I did see the cavities in her mouth. Then I said, do you mind if I get a flashlight and I look in your mouth with a flashlight? And Selena said, absolutely. I went and I got a flashlight. I looked in her mouth. By then I was touching her mouth. She had opened to me nicely. I took a closer look and I said, you know what, Selena? I cannot diagnose everything. I cannot see all the cavities in your mouth. Can you come to my office? I have a very special light so I can see your cavities in my office. And she agreed. And she and her grandpa came to my office the next day. I did a complete exam on Selena. On that very appointment, a very true story, I actually drilled out those few tiny cavities that she had without numbing her. And that happened in Bellevue, Washington. What does it tell you? As soon as you humanize the healthcare professional you're dealing with, they are just another human being. They are there to serve you. They are there to take care of you. And if you ever come across one who doesn't feel that way or who doesn't think that way, and they think they are better than you, or they feel like they are God's gift, therefore you have to be there and kind of bowing down to them and all that, you are in the wrong office. You are with the wrong healthcare professional. But as long as you are with a healthcare professional that you feel a great attitude coming from them, understand that this healthcare professional is just another human being that took an oath to take good care of you. That is by far the most important part that you have to do before you enter a healthcare office. The next thing that you need to do, you gotta make sure that you're aware of your surroundings. When you go to an office, make sure you get a tour of the office. Have somebody give you a tour. There is something they call fear of unknown. It's funny when it's a fear of unknown. You don't know what the unknown is, so why are you afraid of it? But when you are fearing that you don't understand, you don't know your surroundings, that is legitimate. So you're sitting in a dental chair, you're walked from the reception area and you're walked into a dental chair. You are entitled to know what is in the next room. You are entitled to know where is the sterilization area. Where are they cleaning these instruments to make sure they are nice and clean? Where is the doctor's office? Where is the kitchen? You know, all of those things are very important for you to get a nice tour of the office, so you do not feel that you have gone into an unknown space. That's some scary place. And now you're coming into the next part of dentistry that's extremely important. You have to make sure that you are in charge of your appointment, whether you are in a physician's office, whether you are in a dentist's office, whether you are in a chiropractor's office. You have to be in charge of your surroundings. You have to be in charge of your destiny. The moment you feel that you are helpless, that's the moment your fear will kick in. So make sure that you create some kind of a communication means with your healthcare professional. It's easier when you go to a physician, when you go to a chiropractor, because you can verbalize, you can talk. It becomes more difficult in a dental office because your mouth is open and they're working on you and you just feel you have lost control. I give you a very good example. I went to my physician office last year, and as my physician entered, he was in a little bit of a hurry, and he put his gloves on first, and then next thing he touched this drawer, he touched that drawer, he touched a whole bunch of things, he touched his pen, he touched a bunch of things, the charts, and then he started giving me an exam. And that's okay, touching my skin and all that, but as soon as he said, basically giving me, checking my oral cavity, a good physician checks everything. As soon as I said, "Doctor, I hope you don't get offended, but do you mind changing your gloves?" The moment I said that, he was taken back for a second, like, "Yeah, you're right. I need to change my gloves. I did touch a lot of things." So don't think that your healthcare professional is on top of everything and is aware of everything, because they're already thinking about so many things. They're thinking about how to take care of you, so they may forget something about the OSHA and all the controls that they have to do to make sure infection control is at its best. That's a very good example of it. So when you are sitting in a dental chair, the dentist has to offer to you that in case anything bothers you, in case you need me to stop at any given point, raise your left hand. And of course, that's for a right-handed dentist like me. If a dentist is left-handed, you just raise your right hand, not the left hand. If your dentist offers that to you, great, fantastic. But if your dentist does not offer that to you, please let her or him know right away and say, "Doc, can we set some ground rules right here? If you do anything that I feel uncomfortable, or if at any given point I need to stop, I need you to stop, I will raise my left hand and I would like you to stop." As soon as you do that, you'll be amazed how well you will do in a dental office. All the studies show that the moment a patient feels that they are in charge of their appointment, they feel that they can stop the healthcare professional at any given point and communicate, that moment your pain threshold goes so much higher and you can tolerate a lot more discomfort. Try it next time. So get that communication established, the path of communication, and do not be shy. Don't feel like if I stop the dentist, he or she is going to get upset. That's not true. There is nothing worse for a dentist to work on a patient and the patient would feel uncomfortable and create unwanted hate. It's really the word I can think of. Dentist wants to be loved just like anybody else. So you are doing a favor to your healthcare professional to stop them when something is bothering you. And it could be something very simple. They may be working on you and there is a little bit of water in the back of the throat. Even a small amount of water, to you it feels like you're drowning. You raise your left hand, they stop, and you tell them, get the suction, you use the suction and say, sorry, I felt like I was drowning. Or I just needed to catch my breath. Something simple as that. And that's okay. Sometimes you may even need to go use the restroom. And you feel so embarrassed that you interrupt or stop the dentist that it makes your appointment so uncomfortable. Be in charge of your dental appointment, and you will see all the difference. Throughout the years, I have treated a lot of patients who have feared dentists, and I made sure that they take charge of their appointment. Could be something as simple as the dentist leaves an instrument on the patient's chest because they are in a hurry, and the patient does not feel comfortable with that. We all have our zones of comfort. When you are this close to a person, you are already inside that very private zone. So when you are in that zone, you have to make sure that you know you are in charge. And this applies to everything. You have to, one of the most feared things in dentistry is the fear of needles, shots as we call it. But if you know you can stop your dentist at any given point, you can tolerate that a lot more. The sound of a drill. Why are we afraid of the sound of a drill? It's because somebody was working on your teeth and they were not paying attention that this actually was hurting you, and they continued working and you continued tolerating it. It's just another sound. And on top of that, feel free to take a part of your home with you to a dental office. You are a 25-year-old person and you have a favorite stuffed animal. There's nothing wrong with you taking the stuffed animal to the dentist with you. I don't know if any of you folks know who Mr. Bean is, a funny British actor. He always has his little teddy with him. You can have your teddy with you. There's nothing wrong with that. It doesn't matter if you are a 30-year-old guy, macho, and you feel like, wow, everybody would laugh at me. No, you make your appointment comfortable. If you have a favorite little pillow, neck pillow, if you have a favorite music, take your headphones. If there's a special drink that you'd like to take with you, because unfortunately, in dentistry, they make almost everything taste horrible. The impression material, anything you put in the mouth, I don't know why they don't make these things taste better. Even the one that says it's strawberry flavored or it's watermelon flavored, it truly is not. I don't know where they're getting their strawberry or where they're getting their watermelon, but they sure don't taste like that. So make sure you get your favorite drink when the dentist is giving you something, like whether they're taking impression, they are giving you anesthetic, they're using something, and as soon as that horrible taste is in your mouth, just take a sip of your favorite drink. Except alcoholic beverages. Don't take that to the dental office, because it, for one, the smell of alcohol is really overpowering, and it makes it very difficult for the healthcare professionals to work on you, and also it can create a situation that you're under influence. But you can easily take if it's watermelon juice that you like, take that. If you like apple juice, if you like milk, whatever you like, take your favorite drink with you. Your favorite drink, your favorite music, your favorite everything. Then you might as well feel like you're in Hawaii and you're laid back, and here is the dental light that's from above. Imagine it's the sun. Imagination goes very far. And remember, the most important person in your life is you. Remember, you're there because you're there to take care of yourself. You're there for improving your smile. You're there to improve your health. So be excited about it. We look forward to see you at our offices.